79% of healthcare workers report secondary stress and vicarious post-traumatic growth. So in this video, we're going to talk about vicarious trauma and how to deal with it. Hi, my name is JD and I'm a statistician and music therapist here to offer statistically significant support. And if you don't mind hitting those like and subscribe buttons so that you can get the support as it comes out. Also, if you have a topic you'd like to discuss, leave it in the comments because this video comes from a recommendation by Sandra and it's a great topic, one that's absolutely needed. So thanks, Sandra, for the recommendation. Secondary stress is related to job burnout and compassion fatigue, which has even been called secondary traumatization. In other words, what increases compassion fatigue will also increase burnout, vicarious trauma, and PTSD-like symptoms. Both secondary stress and vicarious trauma come from secondary exposure to the survivor's trauma, and both display PTSD-like symptoms. But vicarious trauma also changes how you see the world, and it affects you emotionally. It comes from continuous empathic engagement with the traumatized survivor. Basically, you're constantly exposed to the survivor's trauma-related imagery and intrusive thoughts, and these can stick with you well after you're done interacting with the survivor. Even therapists who treat trauma often experience the same PTSD symptoms as their traumatized clients, despite only hearing about the secondhand trauma. And for therapists, it can diminish their ability to provide treatment. These PTSD symptoms might include flashbacks, nightmares, fatigue, and intrusive thoughts, all of which impact your empathy. Emotionally, you can end up feeling unsafe. You can also feel a deep sense of helplessness and sadness, frustration with relationships, anxiety, heaviness, physically and emotionally drained, distress, and detached. In one therapist's words, "So then I get angry when I hear about what they've gone through in that moment, or I get sad. It's been hard. I would have trouble staying present. I would have trouble staying connected. I would get tired." Experiencing shock is a typical emotion that comes from listening to the traumatic events, and it comes up consistently in the research. Some therapists have even reported never hearing anything like the traumatic experience before and thinking that it couldn't even happen to begin with. This therapist stated that you're trying to empathize with the patient while also not looking horrified because you don't want the patient to think that you're judging them. However, the more experience and time you have, the less impact these overwhelming negative emotions and distress will have on you. What's happening is that as you hear the negative event, you're able to understand that, oh, I've seen this before, I've heard this before, I know what to do. So you're coming from a place of empowerment and wisdom. New therapists tend to struggle with vicarious trauma more than experienced therapists do. Therapists with few years experience found the work extremely challenging and emotionally draining. They wanted to pull away from the survivors, establish boundaries, and avoid over-identifying themselves with the survivor. The more experienced therapists, however, were able to engage in the trauma work without the emotional toll and were able to distinguish themselves from the vicarious trauma. That is, in fact, one way to fight the detrimental emotional effects of vicarious trauma, which is being empathic without enmeshing yourself with the survivor. Instead, understanding that you're two separate people. Basically, it protects you from the vicarious trauma. And other ways to protect yourself include feeling satisfied with your work and feeling effective in helping the survivor. You can also feel grateful and gratitude and appreciation for your own life, and that will also help. Mentally, vicarious trauma changes how you see the world, and it can change how you think about your psychological needs, which include safety, trust, esteem, intimacy, and control. For example, we all have a psychological need to view the world as safe, but constant secondhand exposure to trauma makes you view the world as unsafe and people as untrustworthy. The shifts in your worldview can come from the empathic engagement with the client and can affect how you view yourself, your identity, other people, and the population as a whole. They can also lead to inappropriate therapeutic boundaries like missing appointments and inappropriate contact, and the survivor's trauma can even permeate your memories. You want to fight the mental changes of vicarious trauma through different outlooks on life. So having a positive, optimistic, and hopeful outlook all will help. In fact, this therapist states that you have to have a sense of eternal hope, and if you can't find that, then you end up leaving the field. You want to see the world as a place of beauty and potential while being optimistic that the therapeutic process is meaningful, that problems are solvable, and that people can only tackle what they can handle. Just as important, you want to view the survivors as growing and the trauma as beneficial by seeing the trauma work as planting seeds instead of looking for huge gains. By accepting that there are no instant results, you'll be able to appreciate the small changes. This therapist even states that noticing the small gains in one patient is worth 3 other patients. Now, I can't get through this video without talking about self-care because it's a general but important activity that reduces vicarious trauma. But just because you believe self-care is important doesn't mean you're likely to do it. In fact, overworking, too much stress, and having maladaptive beliefs leads to doing less self-care, all of which vicarious trauma makes you do. But practicing therapists, however, report that not taking care of themselves puts them at risk for harming others. Self-care should be holistic, cover your physical, emotional, spiritual, and aesthetic needs. So check out my video on self-care for more tips on how to properly engage in self-care, because it's more complicated than you realize. You also want to make sure you have a support network and a supportive work environment. This work environment should give you a varied caseload, clear boundaries, and supervision, because the supervision provides resources, validation, and support. Religious and spiritual practices are also important because they will reinforce that people are resilient, that there's more to life than suffering, that your work is meaningful, and that people can grow even through trauma. In fact, you can experience post-traumatic growth from indirect trauma, and you can experience vicarious trauma and vicarious post-traumatic growth at the same time. And this therapist is saying that even though they feel sad and sorry, they also feel empowered, and being able to assist people becomes that tangible thing that they can latch on to. Both vicarious trauma and vicarious post-traumatic growth come from your empathy with the traumatized survivor, but which one you experience is based on your worldview. And this therapist is even saying that even though you're sitting in the darkness with this patient, you see this courage come out of them that's even beautiful and even stronger than the trauma to begin with. But to put yourself in the state of post-traumatic growth, you need to see the survivor's growth, and it can be just as shocking to see them cope and grow. You also want to see them as resilient, that they have inner resources and strengths. Distracting yourself to get distance from the situation and reframing the trauma in a positive light both lead to more vicarious post-traumatic growth, because let's face it, sometimes you just need to get away from the trauma and to stop experiencing it. However, it's also strongly suggested that you can benefit from embracing the trauma rather than distancing yourself from it, as secondary stress provides the fertile ground for vicarious post-traumatic growth to occur. The path for this is that traumas cause psychological pain, which bring about mental restructuring like more wisdom, stronger relationships, and more acceptance, and it leads to being open to new experiences. But you still want to use your coping skills to promote vicarious post-traumatic growth. Vicarious trauma does change you, but the positive changes mean that you will value your profession more, trust in the therapeutic process, and become better therapists. Thankfully, these changes you'll experience to your worldviews, these positive changes, will become permanent. So if you like this video, please give it a like button, and if you want more content like this, hit that subscribe button so that I can continue to bring you more statistically significant support. Thank you.